Hi everyone, this is Andre. Welcome back to my live. Um, Today's topic is what is dampness. So I did this topic because actually it's more for our Chinese speakers because they right now it's quite common that when they go see their TCM doctors, the doctors will tell them, "Oh, you have really severe dampness, you have a lot of dampness." So like even when they go for massage, their massage therapist will tell them, "Okay, you have a lot of dampness in your body." And they were like, "Oh, okay, so okay, I understand that. Okay, I have a lot of dampness." And then when they could tell people, "Okay, I have a lot of dampness," but nobody understand what they are talking about. And I just recently realized that people, especially with Western medicine, people are looking for a diagnosis. They're not looking for a treatment. They're looking for a diagnosis. As long as they have a diagnosis, they feel like they have a peace of mind. I don't know why that is. I mean, a couple months ago, I heard somebody who went through like took a long time, maybe 6 months to a year, went to many doctors, specialists, and finally get a diagnosis that whatever she had was called fibromyalgia. And then she realized the doctors told her that there's no cure for it. So, like, I mean, why would you give somebody a disease that you cannot treat, right? You give a diagnosis but you don't have treatment for it, then what's the point of getting the diagnosis, spending all the time, all the money, the resources? It doesn't make sense to me. And because I guess modern medicine works on, they treat each they have one drug for one disease, kind of like that. It matches 1-to-1. So people kind of are used to, as long as I have a diagnosis, then I can find the cure, or I can find a treatment. But that's not the case. In Western medicine, there are so many diseases they don't have any treatment for right now. They don't even have anything that can control it or even help with the slightest bit. So what's the point of getting a diagnosis, right? But in Chinese medicine, it's different. We don't need a disease. We don't need a diagnosis of a disease name. For example, we don't need to know you have your arthritis is the normal arthritis or the rheumatoid arthritis, or the whatever arthritis, or I don't know. There are so many kinds of arthritis, but it doesn't matter to us. To us, it's just joint pain. So as long as I know where the pain is, I know what kind of pain, what makes it worse, what makes it better, I can probably treat it, and with some good therapeutic effect, rather than knowing what you have, but there's nothing that helps. Right? So Chinese medicine is quite different than Western medicine. And since we're on the topic, that's kind of explain what is dampness, and why is Chinese medicine considered that is an important factor of your health. So we have something called external evils, and that's the direct translation. So the meaning is environmental factors. So when the weather is very windy, or when it's cold, or when it's hot, or when it's very damp, or when it's dry, when it's extremely hot, they have different effect on your body. So for example, if it's very windy and you were standing outside in the wind for 3 hours, then your body might start to you would start to notice some change in your body. So for example, you kind of feel cold, you have shiver, you might have a little bit of fever, you have body ache, and we call this attack from the wind. And there can be attack from the cold, can be from the summer heat, or dampness. So these environmental factors can affect your health in certain ways. And this now, because our topic's dampness, is going to more about dampness. Any of these environmental factors can affect any part of your body, depending on which on your body constitution. For example, some people are weak in certain ways, or some people are deficient in certain way, or some people are strong in certain part of the body but weak in a certain part of the body. So it's the manifestation is going to be different. For example, if the dampness attacks your head, you're going to feel like your head is very heavy. You feel like there's a very a heavy wet towel wrapped around your head. It might affect your brain, how you think, your visions. Can be anything on your head. If it's affecting your lung, then you might have cough, a lot of sputums, or even running nose. If it affects your stomach and spleen, then you can have diarrhea. If it's affecting your bladder or kidneys, you can have urinary issue by maybe you're peeing a lot very frequently, or there's a lot of fluid retention in your body, but you cannot pee. Or the dampness can affect your muscles or your skin, and you have swelling in certain area of your body. So by telling your TCM doctor, your practitioner, or your acupuncturist, I have a lot of dampness, I have serious dampness, it doesn't help them to diagnose you or help them to treat you at all, because depending on the area it's affected, you have going to have different manifestation. You might as well tell them that I have this and that symptoms, then it will help them to formulate a more complete and better diagnosis of you, and then provide a better treatment for you. So I think most of us English speakers don't have this kind of issue, because they probably don't have enough TCM experience like most Chinese speakers do. But it's something to consider, just something, just a little bit of TCM knowledge for you. Anyways, so today this is just it. I only want to talk about the dampness. And if you find yourself have these kind of symptoms, you can go see your acupuncturist, your TCM doctor, to tell them your symptoms, and they will be able to help you, rather than tell them to like, oh, I know, I have dampness, and please treat this dampness. Or I have some patient who came to me and says, I have a friend who has severe dampness. Do you know can you treat that? Do you know how to treat that? I'm like, I don't know. What are their symptoms? Tell me his or her symptoms, or have them come see me, then I will know. Without seeing that person, I have no idea what you're talking about. Or some patient who tell me, can you prescribe medicine for dampness? I'm like, what? I can't, because I don't know what is going on with your body. And then I asked further question, and then the person told me, I have a lot of acne recently. I think that came from dampness. I'm like, how did you end up with that conclusion? It's like you know better than I do, right? Anyway, that's it for today, and see you next time.